Gives me great pleasure to welcome our next speaker. Our daughter Shay was born during COVID. That may be an experience some of you in the room have had as well. Incredibly difficult to get access to anybody. As Shay developed or didn't develop, physiotherapy was being done over Zoom phone calls until we managed, through word of mouth and internet research, to find this beautiful lady just down the road from us. So we managed to get Shay into 18 or so months of physiotherapy sessions with Anne. The increase in development was incredible, and Anne is somebody that we'll forever remember, especially when we look at younger pictures of Shay from that age group. Anne is a physiotherapist who specialises in treating and dealing and helping people with neurological conditions. So I have no doubt that you'll get tremendous benefit from listening to Anne and asking questions of Anne at the end of her presentation. So without any delay, ladies and gentlemen, Anne Pimm.
Thank you so much. My voice is really quite quiet, so just let me know if you can hear me all right, and just remind me to speak properly. That's not my I'm not a speech and language therapist. But I'm very passionate about what I do. My specialism is working with the brain and the spinal cord, so all neurological conditions. I tend to work in complex neurological conditions, and I've worked all over the world and been honoured to be able to work with some amazing people over time as well. So, and of course my heroes are my patients. They're just incredible. I am a bit of a hippie as well, so I'm going to just start with a couple of mantras. So, your child is perfect, or enough. But the world isn't. And I think this is the thing when we're looking at all the issues. I think that's the thing to remember. My child was diagnosed with something at 8 months old, and it was incredible to see the medical profession from the other side. I was quite horrified, really. Even physiotherapists, or maybe especially physiotherapists, but because I know what we can do to help people. So to see the other side of it as well, I was actually told the diagnosis and then told, we'll take your child, you need a cup of tea because you must be grieving. And I wasn't. I was very proud of my child, and actually, really inspired by him as well. But obviously the world's not, and it is difficult to have a child with GANDS, and so hopefully I'm going to give you things that's going to help find the right thing for your individual child as well. So, you know, if we could find a gene to stop people from committing crimes or bringing war about, then I think that would be really good. And so I think it's just making sure that we keep that mindset that actually your child is perfect the way they are, and definitely enough. You also know your child better than anybody. So I think more so when you've got a child who has an unusual neurological condition. People are saying, try this, try that, and this is going to be, or this really, really helped this person, and this therapy really, really helped this person. You know your child better than anyone. So listen to yourselves as well, because it is that knowledge of your child. No one's got that. So that's really important. That's what I learned as well. It was really surprising. People were telling me things and I was thinking, that's not resonating with me. And they were saying, no, you need to do this, because if you don't do this, then you're going to get this problem and that problem. And I was thinking, so you know your child better than anybody. You're the experts on your child. This one, it's a great mantra. If it works, it works. If it doesn't work, it doesn't work. So I think some people think because it works for 99% of the population, it's going to work for my child. If it works, then that's great. And it's good to give things a chance. So the time of inflammation, the period of inflammation is 14 days, and that's so 2 weeks is usually quite a good amount of time to think if something's going to work, it's going to work. There's some medications, like the epileptic medications, where they say 6 weeks to give it a good chance. But if something works, it works. If it doesn't, it doesn't. And I'm amazed how many people will come to me and go, we've been doing this for 2 years. And I'm like, is it working? No, but they're still doing it. So I think it's just like your knowledge is the best knowledge. And if it's not working, there'll be something else, and someone else will be looking for that other thing as well. So it is important to leave the things that don't work and move with the things that really do work. That's the hippie bit over with. So the aims of the session is to try and get an understanding about what is important in neurophysio for your child with GANDS, and why that is important. So what's the long-term effect of what you're doing now? So this is great to follow the previous speaker, talking about digestion, constipation and reflux. And I think what I'd like to talk about is the feedback and feed-forward loop that we have with those issues, and I'll explain that more in a minute. Also sensory training and sensory processing, and what this means with a child with GAND, especially regarding pain and risk management. Could I just have a show of hands whose children you think has got a problem with sensory processing of pain? Okay. Got a bit of a shiver then. Okay, we'll talk about that. And risk management, like assessing risks. Show of hands again. Okay, thank you. What muscle tone is and how you can manage it. Posture, weight bearing and its impact. And why what you do every day is significant to your child's current and future development. So it's kind of like thinking about what you're doing every day. You know, if you go for an hour's physio a week or even 3 times a week, we're not magic. Don't put us in too high an esteem. You know, it's what you do, those little bits of time that's important, really. And this is why, as a physiotherapist, I think it's really important to empower you in the knowledge. You know, not teaching you to be a physiotherapist, because lots of different things, but empower you in the knowledge for your specific child with the specific needs that they've got. I do like a bit of empowerment. Okay, so talking about digestion and this feed forward and sorry if that's a bit small, and feedback. So we'll talk about muscle tone a couple of times. So it's thought that low muscle tone, which is also called floppy, is called hypotonic. I don't know why all it means is that the child is floppy, which is more common in GANS. Although sometimes we have a bit of a mixed pattern, so you'll have some floppy muscles or hypotonic and some high tone muscles. Sometimes you get a bit of a mix, but it's predominantly hypotonic. So this can result in poor digestion, so difficulty, if everything's floppy, difficulty swallowing, constipation, everything's just floppy, or diarrhea, and reflux as well. Like we've just heard, that is a muscle, that sphincter is a muscle, so if you're floppy, then that muscle doesn't work. Like every other muscle in the body is a bit low tone. And high tone, so stiffness and hypertonic muscles give the same results. So the sphincter can be tight, then constipation, everything's stiff around here. So both can cause problems with the digestion. Feed forward, which is something that I really believe is massive, and I've seen a lot of evidence to show this. I'm not a researcher. But the hypothesis is that digestive problems contribute to those tonal problems. So the reflux may be causing the reduction in muscle development. And that can be evidenced in malnutrition, inflammation, reduced activity, gut biome imbalances. So addressing those digestive issues that I've talked about and supporting the overall health can help muscle tone. So it's a bit of a, I think it's probably a bit of a cycle. Sorry, I've got a bit of hay fever. I think it's got a bit of a cycle between feed forward and feedback, but what we need to do. So what I've done is given you some takeaways. So this is the gift bag from me to you. So this is your first takeaway. So abdominal massage. So this is something that I do with a lot of children with complex neurological conditions. So abdominal massage is, I mean, people think of massage as very basic. Actually, it brings a lot of health benefits. Obviously, in the early days, it helps you connect with your child as well, which is massively important, as we all know. But it also can help with the digestive system. If a lot of children with GANDS have constipation, and so if we can minimise that constipation, so you think you've got the pressure pushing up here, you've got a bit of a weak sphincter, you know there's only one way things can go if it's not going in the proper way. So we just need to make sure that the simple things aren't overlooked, you know. I like making things simple. So it's so I'm actually a clinical aromatherapist as well, as part of my hippie side. So I use aromatherapy mixes as well, and honestly it really has changed not just the constipation, the digestive problems, but the muscle tone problems as well. So I know when Shay first came in, if you don't mind me saying, I was like, I can't start treatment here. We had no muscle tone, but we had really serious reflux, we had really quite serious constipation. So that's kind of where we started. So as a physiotherapist, it was unusual to start there, but I just thought there's a definite block here. Until we get over that block, we're not going to get any improvement. So that's where we moved on from. And basically, there's a lot online about massage, abdominal massage. Basically, it's clockwise direction. I teach it. It can be a bit complicated when I teach it, but it is, you know, you can teach yourself online, that's no problem. And also the aromatherapy oil. I was going to put a little recipe out, but it just depends if your child's got epilepsy, so some of the oils are contradicted in epilepsy as well, but a lot of them are really safe. So I have personally found positive results in sleep hygiene. So like we were saying before, so taking it back, stepping back and just thinking, what can we do to improve sleep hygiene before it becomes a problem? So sleep hygiene, I just mean that they're getting enough sleep, not getting as much disruption and restlessness. Also achieving developmental stages, because I think you can't achieve those developmental stages if you've got that underlying problem there. And also you get the reduced fussiness, which is what is really hard as a parent, to have that fussiness, but obviously all of us are fussy if we've got constipation. Okay, obviously again looking at your child's diet, I'm sure this is something, I mean nutritional services are not that bad, and it's quite it's quite easy to get the information that you need, but that is important to have a look at. And this is important for bone health and muscle development as well. So increase your child's time in an upright position. So just thinking about when they're little, you know, holding them upright, rubbing the back, rubbing the stomach in that position. When they get a bit older, just, you know, if they haven't got an upright posture, this is why standing frames are really important. And this is, you know, just holding them up, supporting them yourself. Okay, interrupt me if there's anything you need to know. I'm trying to go not too slowly so you can get your lunch. Sensory processing and pain. So this is massive. This is really a baseline, you know, being able to process pain is massively important. So if we can't process pain, we can't protect ourselves. So when I first realised this, then it's kind of like, okay, we need to stop now. Obviously you don't pick it up when a child's a baby, because you wouldn't expect them to do that, but when they start flinging themselves off sofas or taking risks, then you kind of realise that this may be a bit of an issue, and it needs to be addressed. And I think this would be a really important area for research. If I was doing my my masters, this is where I'd do it in, because it's massively important. It's very difficult to assess sensation processing in a child with GANS, and pain as well, because it's an abstract concept. It's very difficult to understand pain anyway, and how everyone feels pain is different, but it's a very difficult thing to assess. So if you can't hold something, then it's very difficult to treat it then. So they may present by surprising you by them not, you know, hurting themselves in one way. I've got a little boy who runs into a glass door constantly because visually it's glass. We've had to cover it now, but he hasn't learned that if he does that, then he's going to hurt himself, because he doesn't understand the sensation of pain and prevention of pain. So that risk assessment, that avoidance of risk is not there, and it can be not present completely or disrupted, and it is something that needs to be addressed by all the team. So it's not just because you probably picked it up naturally because you were moving with them every day, and you kind of knew your child's got GANS, and so I need to care for them that little bit extra. So you're doing it and you're being aware of it, but other people may interpret it differently. So the therapy intervention is to encourage your child to learn different sensations. So your takeaway here is teaching your child the body parts. So if they can't identify the different parts of them, I know it's hard for us to understand this bit, a sensation, but if they don't know the difference between the head or the neck or the knee, then it's very difficult to be able to tell you that something hurts or to identify that part. So for you and me, if we've got a broken leg, we can go, oh, I've got a broken leg, it's painful, it's giving me lots of feedback. And so, but for a child with GANS, they may not even stop walking if they're a walker, you know, they could still walk on that. They may show a limp or something like that, but nothing in their behaviour may identify that there is a serious problem there. So you've got to be a bit of a detective. There's lots of different levels that you can work at, testing out different things, you know. So even with someone who is not able to talk to you, you can kind of like have pictures of different parts of the body and just identifying with those when you're touching them and just gradually introducing the idea of different parts of their body. Talk about different types of touch, like soft touch. So we've got different receptors. So this is something that we need to know, that we've got different receptors for different sensations. So you can actually have the feeling of soft touch, but not be able to feel hard touch. You can actually not be able to feel temperature, but be able to feel all of the sensations. So there's 7 different types of sensation receptors that you have. It's so clever, isn't it? The nervous system, the brain. So you've got all these different things. So talk or at least expose your child to these different sensations again, using sign language or using pictures or whatever is suitable for your child, for them to start associating that these are different sensations. So we've got to find another path to learn about pain and about risk assessment. If your child has any, can I just have a show of hands about hypersensitivity? Has any of your children got hypersensitivity in their hands or feet or anything? So just a couple, 3, 4. So this is important as well, for risk as well. You know, if they're not able to use the hands or the feet for certain things. So it's important to work to desensitize those areas with massage, water or sand play. Okay, so when you see, so ways that you can progress this then. So when you see your child falling or bump into something, point out the area you think that they've hurt. So if they've fallen and they've fallen on something they think is quite sharp and they've maybe injured the knee or something like that, then point to it and say, ow. So really emphatic awareness that they've hurt themselves, and rub the area better. And then afterwards you'd be encouraging them to do that themselves, or actually talk to them about not doing it again, whether that's with sign language or whatever, but just trying to give that information into their nervous system. Because it's an unusual concept for us to learn that you don't have pain. It's difficult to realise the information that they're going to need to build up that nervous system response to pain. So you've got to retrain that. And just discuss how it feels. If you hurt yourself, you can do the same thing. Whatever you choose, but something emphatic, something repetitive, something that's not associated with another word, and just ow or whatever. Okay, more on this. You can tell I'm quite passionate about the importance of this. Using simple, emphatic words to prompt your child to take more care, like saying care or safety. So this is what we said with Shay. And show them how to deal with it. And it is amazing that a child can learn, if you say that word, safety, they can learn how to deal with that particular dangerous situation every time if you say that word. Now, when you're not there, they may not do that same behaviour and then hurt themselves. But for example, getting off a sofa with Shay, we turned around, went feet first, and Shay could do that when Rebecca said safety. And even now you use that same word, don't you? So that's a repetitive thing. But am I right? Getting off the sofa sometimes, would she just jump off if you weren't there?
Yeah, fall backwards, or not even realise she's sat on the edge.
Yeah.
And then just remind her again and again and again. So
Yeah.
now we're somewhat there, but she has to concentrate. So
Yeah.
it's like bringing her back to concentrate.
Yeah.
Recognising the word and then doing the action.
Yeah.
It's It's a lot.
Yeah, so it's like, so she's got to learn that, like we learn to crochet or knit, you know, it takes a lot of focus. So they're not any less, but they just haven't got that part. So we just need to relearn that part and put that connection back in. But the fact that if you say a word, then she can do the action is massive. But it's got to start somewhere. It's got to start on a process somewhere. And just ensure that all the team that are working with your child, or grandparents, or you know, if they're going to a nursery or whatever, that just try and explain about how your child deals with pain or doesn't deal with pain, and that it may present as bravery, which is also like, oh, you know, they're so brave, you know, they just get up and run off. No, that's not good. It's not good. We need to have this plan in place to say, ow, and deal with it, and not just run off, and because they may be running off because something noxious has happened and they don't know how to deal with it in their nervous system. And sometimes it's a gung-ho personality, you know, oh, they were the first on the zip wire, or, you know, they don't care about anything. But it is so important to teach safety, to break it down. Okay. Also, I teach parents to do a body scan. So sometimes children they can't tell you where the pain is. So you just need to do a bit of a body scan to find out. So starting from the head, checking the ears, and you usually get, even though they can't tell you, some reaction from wherever. Or you can feel some heat. So it's just being aware that any inflammation, any pain is usually, you've got some heat there as well. Okay, so just like work through everything, just have a feel, just check out if there's any pain or any, you know, any bony abnormalities as well that you wouldn't see. Okay, is everyone okay about that? I am going to be here afterwards if you want any questions. Muscle tone. So tone can be normal, high, low, or we can have a mixed tone. I'm just going to, I think you're going to get all these slides anyway. So high tone, like I say, there is a lot of different names, and it's, you know, and whether we need to know what it means to us. But I think when you go to medical appointments, it is good to know all the different terms, because if they start saying something different, you can think, oh, is that the same, or is it a different? It's not, it is all the same. And it just, so high tone is resistance to movement, the normal movement, and the low tone is this floppiness. And I think, I mean, it's like, I don't know if we've got any engineers here, but it's like an engine. You know, if you have a stiff area, then you have a loose area, and if you have a loose area, you have a stiff area somewhere else for things to work. And so it's usually a mixed pattern, but I think the predominance of low tone is in GANS is significant. So we've got to look at things to take away from dealing with muscle tone. It's really important to give your child normal postures and normal movements as early as possible. So you want to replace those positions that your child would normally get into. So I mean, the head and neck isn't brilliantly designed in that we've got very small muscles. Anyone who's had whiplash will know this. We've got very small muscles around the neck, and we've got quite a heavy head because we've got our brain in there. We've got quite a heavy head, and so getting head control is really difficult, because if we don't get it in the very early days, it's going to take a while to develop that then, because you've only got small muscles, and then your head's growing because all your body is growing. Your neck muscles don't grow into the same rate as that can protect your head and lift your head up. So in the early days, it's important to use different positions. So I don't know how early you got physiotherapy. Something that I feel quite passionate about that I'd love to work in is babies, working with babies, because the difference you can make in early days is significant. Using prone, so lying on your stomach, lying in side lying. These are all developmental stages, so getting your hands together is really, so side lying is really important to get your hands together, and you learn a lot from having your hands together as well. So rolling, so if your child's not doing it, it's important to do with them. 4-point kneeling, so kneeling on your hands and your knees. Commando crawling, so I've done this with a lot of children now, so just replicating commando crawling, but it's great, you know, you've got one arm, one leg, so going like that is brilliant. So there's physios that just do that, and they ask parents to do it 4 hours a day. It's not a therapy that I'd recommend, but doing it as part of a routine is important. Then working in crawling, kneeling, half kneeling. So half kneeling is one knee down and one foot on the floor. Standing and stepping. So it's just putting them into those positions, even if they can't do it themselves, just putting them into those positions while supporting all the joints as much as possible. Because you want them to move through all those different positions themselves. And this is something that you can do, you know, when you're working on dressing or whatever, just getting into the routine of doing things a little bit differently, or positioning them on the side with a roll behind the back or whatever. So I'm not talking a lot about equipment today, but there's loads of different equipment. Basically, you know, standing frames are really important, getting the right wheelchair, using tilt in space in the wheelchair if your child hasn't got head control, using the tilt in space, that's really important to help develop, because you can use the tilt in space and then gradually increase it to upright to develop head control. It's always good to use equipment to do things because it makes it easier. Standing frames, research now shows to use abduction in standing rather than a nice symmetrical position that everyone's been using for years. So for the development of the hip, it's really important. If you've got a standing frame, ask your therapist to just make sure it goes into abduction. Hydro and swimming is sometimes a really good place to be able to achieve movements without the effect of gravity, because gravity can be the enemy of a child learning to move with low tone. So at least it balances out the chances of developing good normal movement in a hydrotherapy pool, where you've got the buoyancy, the effect of buoyancy pushing up against you. So this just allows to access these movements. And also it's really good fun as well. I think as well, I mean, so I argue for hydrotherapy pools for some of my patients, for funding for them, and you know, one of the big things is being able to get in with your siblings and have that contact with your child that isn't a wheelchair or restricted. I do recommend that. Okay. So use weight bearing in standing after age 1. So this is kind of for bone health as well. So just make sure you need that alignment. Like I say, they're talking about abduction in standing frames now. but you do need to be taking weight through your bones when you get to age 1. So that's important, even if that's only supported. This is really important as well for the digestion and the breathing. So when you're in standing, your diaphragm drops, so you've got a bigger space for your lungs to be. So you're breathing, so you feel good. This is why after you've had a big meal, if you stand up, have a walk around, you feel better than if you just sit down. Vibration, I really think vibration is so good for muscle tone. So it increases muscle tone and decreases it. Some children find the sensory stimulation of it not very good, but you can address this by using vibration toys. I know yesterday, as the speech and language therapist talked about the vibration for one of the talk tools, it is similar kind of reasoning. I was going to bring one along today, so a pulse roll we use, which is like, it's used in sports, it's used in football to just massage the muscles, so it's good for parents as well but at the end of the day. But for your children, you can actually use it under a mattress as well, and it's a really high vibration. It's 20 hertz. It's a lot cheaper than any neurodevelopmental vibration equipment, which is ridiculously expensive, and you can just put it underneath a mattress or something and the whole thing vibrates, and that just helps the muscle tone. It also helps bone development as well, vibration. So again, something simple but really quite effective. Spatial awareness is linked to educational development, so if your child's not mobile at age 1, they, you know, the spatial awareness that was talked about, I think, this morning by Dr. Tyler, I think spatial awareness is really, really important, and that maybe plays into why children don't recognise sitting on the edge of a sofa or whatever. But spatial awareness is learned by moving around, by moving in space, and it's not learned by being moved in space. So it's not learned by being carried in space, it's not learned by being in a wheelchair in space, it's learned by you moving in space. So this is why I'm a bit mean with the children I work with, because I'd never hand a child a toy or something that they really want. It'd just be out of reach, and I think that's really important to just be aware of, that if everyone's being really lovely and handing your child a toy and saying, oh, don't worry, I'll carry them for you, and you're thinking, well, actually they can move themselves, or maybe they could move over to that drink themselves or whatever, then they're learning. So them moving themselves in space is a really important job for them to do, and that helps with educational development as well. So much so that in the States, the moving in space and standing frames and powered wheelchairs and things are funded by the education department, not health. So that's really important to remember. In this country, we've got a charity called Wizzy Books, and I've put the link on here. So they're a wheelchair that a child, I think they say from 14 months, and it's a powered wheelchair that you can, they have like all different kind of handholds there. But the powered wheelchair, so it means that the child who's got mobility problems can move in space, and I think they provide them up to a certain measurements. So that's, and it's a charity, so it's free. So, but people don't know about it so much, but it is a really, really important thing to be able to move yourself in space. So, yeah, and little things like, if you're going to go and pick your child up, then waiting for them to lift their arms up towards you. So some movement is better than just going down, picking them up, let's go, because they're not predicting what's happening to them. And it's all that, teaching the brain. Okay. Okay, so posture and weight bearing, it's important to develop a symmetrical skeletal system, and that's not just to look pretty, it's to make sure that all the internal organs and everything work as efficiently as possible. And this can be the most significant during and after growth spurts. So during COVID, it was really difficult because some children, we just lost them a bit, because if they were in that period of growth, then the bones grow longer, faster than the muscles can develop. And weight bearing is really good for bone health. So we talked about weight bearing, and it's important that that weight bearing is in the correct alignment. Okay, so standing, weight bearing and putting in some vibration. There's a great standing frame that actually vibrates as well. And you can use some postural chairs, standing frame sleep systems, orthotics. So if you find that your children's feet are in the wrong position, always look for some orthotics or something, because again, if their feet are giving them pain when they're upright, they won't be able to tell you that's painful. That's a painful foot I've got. So you need to be the detective for that. Okay, neuroplasticity is my favourite topic. So this is amazing. So do you all know neuroplasticity? So the ability of the nervous system to change. So change is our only constant. This is what's happening. We're all changing while we're sitting here. Hopefully I've got some of your synapses firing. Hopefully something will be connecting in you about what I'm saying. And it happens in our bodies as well as in life, that change. And it's a constant modelling and remodelling of the synapses. And it happens in response to what information you put into the sensory system. So we've got the sensory system and then the motor system of movement. So it's constantly being changed. And so your child isn't static. They're changing every moment, every second. And so, therefore, keep doing the good stuff. Try to stop doing the bad stuff. Whatever position that they want to be in. But trying to keep them in a good position, getting their muscles learning the right stuff. There's a YouTube link there. Like I said, I think you're getting all these, which is just showing the synapses growing together. And that is done by modelling the right movement. And it's physiotherapy, it's rehabilitation, it's learning, it's everything. Neuroplasticity is amazing. So seeing those synapses connecting is absolutely mind-blowing. I've put some other slides in here. I'm going to finish now, but I'm just going to run through these so you know what's here. So we've got the pattern of normal development. So these are... Oh, I went a bit too fast there. So these are all the pattern that you normally develop through. And so you can kind of see where your child's at and what they need. And the components of normal development. So you don't have to... So a lot of children maybe don't crawl, or maybe they don't run, they don't walk, they may just run, you know. So sometimes they leapfrog over a step, and sometimes there's an overlap. So a lot of children obviously bottom shuffle or do something strange to get about, and that's nothing to worry about. I mean, spatial awareness, like moving in their own environment, is the most important thing. And many activities are achieved in the similar time scale. sometimes having a bit of competition, if you've got a sibling or an auntie who's willing to get involved with a bit of competition, that sometimes helps them develop some normal movement. Okay. All right. So the nervous system, it's just a sensory system. It doesn't know anything about movement. It only knows about the sensation that's going into it. So until you put that movement into it, it's not going to learn. Repetition of movement is important. Okay. Any questions? I am going to be around for a bit. I have got a mat with me if anyone wants me to have a look at the child and have a chat over anything, but I'm going to be around here for a little bit. So, question?
Can I just ask you a question? Sorry. You mentioned about using aromatherapy oils and the abdominal massage.
Yeah.
Is there any specific ones that you would recommend that you use?
That's what I was thinking about.
Perhaps working like for everyone.
Yeah, so if your child's got epilepsy, then you've got to be really careful with all oils. But there's a lot of safety in the oils as well, but it's worth looking at all, first of all. Rosemary is one of those oils that for epilepsy you wouldn't want to use, but that's good for the abdominal massage. Black pepper is one that I consistently use, geranium sometimes. So, and again, they're nice, and as well, your child's getting the sensation of the smell as well, which helps the limbic system development. So, yeah, I guess, okay, no problem. And
So what ones can you use with epilepsy?
So, you need to speak to your epilepsy nurse, and sometimes they say no. But there is only a few oils, like I say, definitely rosemary you should use, but there's a lot of oils that you can use, but it just depends how confident whoever's doing that is, but it's always good to get the advice from your epilepsy nurse. I'd say geraniums are nice, it's a balance.
Wouldn't you use black pepper?
Why would I use black pepper? It's amazing.
Yeah.
So black pepper oil, sorry. So it's an essential oil. And sorry, just to clarify. So black pepper, so the aromatherapy oil. So it's not used very much, but I found really good results with it. Yeah. I don't use it in my cooking. You're not coming for tea now, are you?
Our boy is 15 into 16, so he was really floppy. He was banging, and we worked really hard with everything that he suggested today. But he's now at the stage where his last physio signed him off because she said he hasn't got hypotonia anymore. But we were always told that hypotonia is a lifelong condition. Don't get me wrong, he's a lot stronger and he's not so much like a rubber band.
So that's about service provision rather than about your child?
But it makes you think that, so he hasn't got hypotonia anymore, has he?
No. I mean, and it's different with GANDS because he's got GANDS still.
Yeah.
It's a genetic disorder, so you can always, say that. I mean, this is what you want as a physiotherapist, to maximise as much potential as possible, but that's a service provision. And sometimes it's good to shine a light in that dark corner and say, is this because you think my child doesn't need physiotherapy anymore and that you've not got the specialism to help him? Or is it because you're limited for funds? Because if you're limited for funds, then we can talk to your manager and try and get more funds for you. But I think while physiotherapists are saying, oh no, I can't, they're doing really well and you're a great family and you're doing everything you can.
She was adamant that his tone has changed.
Yeah. No. You can get occur with hypertonicity, but hypertonicity is a signal from the brain to the muscles, and so that underlying slowness will probably be always there. But what I'd also say, you know, at 15, that was the giveaway, they're heading into transition. So they're heading between paediatric services to adult services, and they will know that adult services, I don't know if anyone's found this, is just dropping off the edge. Probably doesn't happen in Germany. I need to come and visit Germany. Rehabilitation. But it won't happen in every country. But in this country, with the NHS service, how it's set up, there's a drop off the edge with transitional services. And so it's just really important to just make sure, if it's a service provision, say, I can help you, you know, who do I write to? Shall I write to my MP? Just to try and get that service there, because then that's helping parents coming through as well. And from a physiotherapy point of view, our skills are being lost because physiotherapists are saying, I can't do anything more for you. Whereas, you know, what they should be, it's a lifelong condition, GANDS. And so they should be saying, we'll stay in touch. Maybe you don't want to come every week, maybe you don't want me to come every week or whatever, but here's my number. Let's have a review every 6 weeks and go from there. And then that's empowering you, but also recognising that this condition needs a specialist physiotherapist to be involved long term. Yeah. Yes. But I think Dr. Tyler needs to make a, you know, a cure, because it doesn't, unfortunately, it is a lifelong condition. And the other thing to do is use, you know, if there's a change in your child's presentation that you feel would benefit from a neurophysio, then just say, you know, they've got this now, and then just keep repeating that process. To get the service. Like I say, you're the expert in your child, you know what they need.
From the German perspective, I don't know if you have this in the UK as we have these Galileo boards.
Yeah.
Getting a bit of it, who help, what we experienced help a lot for the kids to feel themselves better. I was talking to you about it yesterday, but when they are put at home and get on this board, they seem to feel like we feel and get a deeper sense of themselves. So it's awareness of themselves. So if you have a chance to do this with any therapist here, I would recommend to do that. These boards are very expensive.
So the Galileo boards, can I just clarify, are they the vibrating boards?
Yeah.
So I use a Hypervibe, but it's not been registered in the UK as a medical device. I don't care. Because it's just about funding again. So that's a block, but I always explain that is. But I mean, the pulse roll, I mean, we usually get them, and we get them different prices each time we order them. We order about 10 at a time, and we usually sell them for about £60, and they can go underneath the mattress, and they're 60 hertz. 20 hertz. So
no, they go right over 60 hertz.
Pardon?
That they are over 20
the Galileo,
right? Yeah. And they are like, in Germany you pay for like 7,000, 8,000 euros.
Yeah.
One or more for the bigger ones.
Yeah, that's the same here. That's the same here. That's the same here. And there is a centre, I think, on the Wirral where they do a lot more with vibration, but they don't do a lot of other things. But I suppose, you know, it's. But I think 20 hertz is a good vibration to be able to access without a big outlay, and you know, I suppose I'm always looking for two benefits, and I think if you can use it as a massage for your low back at the end of the day, that's good. But vibration, you know, I think vibration is massively important, and I think, I've talked to a lot of consultants about it as well, and I think it, you know, it's not simple when you get a Galileo board, and you have to go somewhere regularly, but it can be a simple solution for a complex problem, and a lot better than the medication alternatives. So, yeah. Sorry. Yeah, I think I've finished now, but are you going to go and
Yeah,
have
I'm just going to wrap up the... Thank you, Anne. Can everybody just...